anything like that. So the first thing we do, put some lotion on. All right. I like to get on a knee, but so that I put my hand under. I mean, everyone's going to do it different, but that way I can get my knuckle right through here and kind of go up the foot right in this area. You'll find it gets real tender. Make sure you lean into it. All the plantar fasciitis stuff gets pretty messed up in there. Yes, that's an anatomical term, messed up. Just going up and down, then we'll do some cross fiber through it. Brittany did not mind being the massage dummy today. I asked her if she was okay with getting a foot massage. She's like, sign me up. All right. Sometimes we feel those real tight spots, right? Like I'll feel a little ball right there. You see as she jumped. I like to do is kind of sit on those spots, ease back in, let them relax into it. When I do like trigger points, I try to hold for like maybe 5 to 7 seconds, then release, then do it again for 5 to 7 seconds. Another technique I like to do is get my forearm and elbow in there. How's that feeling? It hurts so good. She's like, I don't agree with that. The good thing about this technique, you actually push and pull at the same time. And then rotate your arm to get it a little different. Next, another technique I like to do to get a good stretch is grab the big toe and lean in. Now that tendon sticks up a little bit more. I can cross fiber a little bit better. So you can get a good stretch as well. All right, get some of the calves. I think I just said calves plural, even though I'm on one calf. Y'all can ignore that. So I've seen a lot of therapists, and I just don't like the technique of dragging a forearm over the Achilles tendon. I think that hurts like crazy, so don't do that. And it's not good to strip out a muscle either. So what I like to do instead is I'll hold their foot down so that they don't kick me, and I'll actually go across just like that, and then just go slowly. You can see I'm kind of turning her foot while going forward with my arm. It can all be pretty tender. Definitely right in this area. How's that feeling? And across. I always like to use their body against it, so it helps you apply a little bit more pressure without having to push hard. And you can actually, I like to do it the other way around too. Again, I'm under her, and I'm going to go across. I need a little bit more lotion on there. You don't want to rip their skin off. And these are more the therapeutic stuff. You can also do the nice kneading. I know a lot of people have knee pain. It's good to get right in here. I think our photographer agrees with this. She's getting a little jealous. Like, what? Our photographer's Kelly, so
feeling the pain for her.
All right. You can stretch it out, like I like to say. Lean into that big toe. Usually feels pretty good. You can put your forearm on top of that. And just lean straight down. All these techniques are pretty good for plantar fasciitis, along with the next thing. It's a kind of get some lotion on there. I'm going to turn the opposite direction on each way. So this is the slow motion version of it. See, I'm working all the way down, and I can do the opposite, push and pull the other way. Now, when I'm actually doing this, what I like to do is just go pretty fast, because this part's working the fascia more than the muscle tissue. And remember, your ankles are supposed to be mobile, so we want this helps with mobility. All right, another thing, I like to really get the inside of the calf. So I can put them in my arm again so they don't kick me. And I go across. When you feel that real tight spot, a lot of times with trigger point, as I'm going across, what will happen is when I feel it, that's usually not where you press. What you do is back up a second and then press in, and you'll get a little bit better. And then release. How's that pressure? You okay? All this stuff's really good for knee pain. Then we're going to get the lateral side of it as well. All right, next we're going to actually have her turn on her back. Take your time. You probably want to come on this side, Kelly. So I'm doing the feet face up. Thank you, Kelly. She's videoing and moving the bolster, or attempting to. She's nicer than I am. I should have done that for her. So it's good to get on top of the toes right through here. I know a lot of times tendonitis can hit right in here. So if you step and this is really sore right in here, that can be part of the reason. Now, as a therapist, make sure you're using your body more than you are your hands. That way, you don't burn your thumbs out. I like to twist a little bit. What's happening on the bottom is I'm just kind of ringing like that.
Do that again.
Do it again? Okay. So just kind of I'm going to try to do it again. Ringing like this. Kind of like an Indian burn. I probably shouldn't say that. It's probably not politically correct anymore. But, that's just what I heard in high school or middle school. So, back in the day when people didn't get offended at everything. And yes, that's on YouTube now. All right. So I do also like to get into the shin muscles, which are also tibialis anterior. Fun fact, a lot of times that people think they have shin splints and they fill it up here, those are actually not shin splints. Shin splints you're going to fill it down lower. But it's still painful as heck when you get that pulled tendon up there. Pulled muscle. She's loving this part. So, I'm using my 3 knuckles to go up it. And the reason I'm backing up a little bit too, so that they can usually take it a little bit better. If you want to do it a little different, you can even lean the toes a foot forward and get a little stretch in the calf while you shorten the muscle in the front. Like I said, use all the tools you can to make the job easier for you. All right, I'm going to get down low. What I like to do now is get my elbow right in here, Now I'm not doing the point of my elbow because I don't want to lose traction and then slide. What I want to do is, okay, if they jump, that usually means back off a little bit. And instead of like stripping it out, which I don't like, I like to do more of a pumping motion. So like I'll lean in, let it release a little, lean in, release. Ooh. That's my way of showing empathy. I say ooh. Now, if that's too much, Brittany, you tell me. She's like, I'm going to be tough for a video. Good. Wash it out a little bit. I'm using the bone right here. You can get your forearm under and kind of pull the bottom and of the ankle and the toes and lean in. Should feel pretty good. Good stretch. A lot of swelling is through here. You can tell she gets a lot of pain in this foot. She had a knee surgery on this leg, so what I'm doing is starting at the top of the bone, not on the bone right here, but right here, just kind of leaning in. Make sure you have enough lotion so you don't burn them. She's jumping a little bit maybe because I didn't have enough lotion. There we go. Helps me gauge how much pressure to use too. Good. I like to spread that blood flow around so that we don't get too sore. What I like to do is that my thumb's actually doing some of the work here, but I can kind of get away with not feeling like it's too much pressure because I'm using a broad technique. Also, it's good. Come under that calf. Do nice stuff after you've done mean stuff. Does that feel good? And you can actually go all the way up the leg doing this. I also like to do, if they are getting a massage, I like to come under the knees and kind of pull some of that tension out of the knee. And it's easier to do without when they're draped and not have pants on, but this is a lower leg video. All right, next we'll get into the feet through here. So you have to change your position a little bit. So I always like to, extend it a little bit and then kind of go across. Notice I'm not pushing too hard with my thumb and injuring my thumb. I'm pressing with my thumb and leaning in so that I don't hurt myself. Pull. You can do a twist. Oh, we popped it. Or broke it. One of the two. Twist it the other way. Remember, the ankle is supposed to be mobile, so you want to get it, a lot of movement in there. All right. All right, guys. Hope y'all enjoyed this little lower leg tutorial. If you want to leave a comment below your thoughts, hit subscribe, and follow us on Instagram. We appreciate you watching and have a great day.